situation in Honduras is project with the hospital he built there, with the community, and also talk about the people who die in the jail, like 400 people there. Welcome to Luther.
Good afternoon to everyone. I'm glad to be here tonight. I just want to share with you a small video before we can start our conversation tonight. And thank you for being here.
Yo soy de la etnia Garifuna, de una comunidad de la mosquitia hondureña que se llama San Pedro de Tocamacho. Los garífunas han estado aquí particularmente por más de 200 años y aquí en este lugar no ha existido médicos, no ha existido ningún centro hospitalario. Algunos médicos pueden venir por una pasantía por 3, 4, 5, 6 meses y luego se le dan. Bueno, ya ahora después de graduado nos ha tocado en comunidades, por ejemplo en Tocamacho, que hemos ido a atender 3 partos en una noche. Creo que es bastante gratificante, ¿no? En la noche la gente golpea la puerta y dice, doctor, ya ahorita. Y tú saltas y realizas el parto, que le ponen tu nombre al niño. Es algo muy gratificante y comparas estos primeros años de la medicina en que tú llegas a la comunidad y tú puedes comparar esa esperanza que tenía el pueblo en que tú retornaras a cumplir con ese deber de ayudar a la gente más necesitada.
Hoy 211 años que llegaron nuestros ancestros a estas comunidades y aún vivimos aquí y nos sentimos tan orgullosos por ese color de la piel que Dios nos ha dado, la madre tierra, la naturaleza, ser Dios en vivo. Eso significa ser garífuna, ser un Dios en vivo.
Antes, nuestros antepasados hacían botes de esto, carritos grandes para viajar de aquí hasta Trujillo, hasta La Ceiba. Esa era la vía de comunicación de nosotros para poder llegar a la ciudad. Pero siempre que se golpea uno, o se fracasa uno, o cualquier cosa que le pase a uno, tendría que ir de aquí hasta Trujillo para poder buscar medicina. Y ahora con eso aquí, es un orgullo grande que tenemos nosotros.
Alguien se acordó de nosotros que nosotros existíamos en esta zona, para que hubieran médicos garífunas, que nos entendiésemos mejor y para que no nos tuviéramos que morir en lo que es el trayecto de la carretera de aquí, de la zona de Viviana, hacia Tocoba. Dios es verdaderamente garífuna porque nos lo ha demostrado que nosotros tenemos el derecho de vivir y tener una educación y salud adecuada.
Al principio, como te dije, tenemos muchos temores porque somos jóvenes y lo primero que pensamos es de qué forma nos van a recibir en la comunidad. En estas zonas ya que hay muchos tabúes que ellos no te van a decir, no te van a soltar como para decirte, tengo tal enfermedad, por ejemplo una enfermedad de transmisión sexual. Es difícil que un paciente te lo diga, ¿entiendes? Por las costumbres que existen en las comunidades, los tabúes, los mitos. En cambio que con nosotros es muy diferente, porque hablamos la misma lengua. Ellos nos comprenden palabra a palabra lo que nosotros queremos saber para llegar a un diagnóstico como tal. Conocemos sus problemas sociales, personales, todas las adicciones que existen, el alcoholismo, la drogadicción, la promiscuidad. O sea que conocemos todo a fondo de las familias. ¿entiendes? Y ellos confían en nosotros porque nosotros nos hemos ganado esa confianza a medida que ha pasado el tiempo.
Decidimos, después de graduarnos en la escuela latinoamericana, hacer un esfuerzo colosal y buscando recursos. Nos donaron este terreno, hicimos una champa de plástico, empezamos a buscar donaciones de medicamentos y empezamos a trabajar para demostrarle a la gente que nosotros tenemos una concepción diferente, una idea nueva de la medicina, de llegar ahí donde la gente, tocarlo. Lo que nosotros buscamos aquí en la sociedad garífuna es crear un modelo. Como nosotros, los egresados de la escuela latinoamericana, bajo esos principios que Fidel nos inculcó, de ser médicos de ciencia y conciencia, integrales e incondicionales, dispuestos a marchar a cualquier recóndito rincón del mundo para prestar los servicios de salud, ¿cómo podemos establecer un modelo en esta sociedad capitalista, un modelo de salud alternativo para los pobres? La misma miseria que nosotros miramos en los países latinoamericanos, la misma exclusión de los humildes, las grandes masas desprovistas, desposeídas, cada vez más los ricos se hacen más ricos, los pobres se hacen más pobres, las masas aumentan más, las cadenas de pobreza aumentan cada día más y más, y creemos de que como jóvenes tenemos un papel fundamental, un rol que jugar en esto.
I would like to give a special thank to every one of you for your time that you are sharing with us. This is a little bit part of our work in Honduras. And in all this Garifuna community, not only Garifuna community, only 40% of our patients are Garifuna, another 20% are indigenous from Mosquito, Tawakas, and Pech communities, and another 40% are mainly campesinos who live in a part of the mountain who cultivate the land. Then we're located, if you see, in it's like technology. We are located in this part of the map where we have the star. We have some brothers from Honduras here who knows the location. Thank you for coming. And I want to share with you a little bit some of our work about healthcare. And this is the reality, the common reality what we face in Honduras. This is most of the pictures that is happening in reality. Then a woman in serious complication of birth have to travel more than 14 or 15 hours to get to the more nearest hospital. It's the reality of poverty in the remote area in our country. Then we had opportunity in 1999, after 1998, after the hurricane missed the straight part of the Central America. Honduras, it was one of the countries who was very affected for the hurricane. Then Cuba was one of the countries who come and help Honduran people and send a team of doctors to work in the more remote area in Honduras, particularly in La Mosquitia, another remote area. Then after that, they decide how they can give sustainability to these projects. Then they decide to open the Latin American School of Medicine with a beautiful space in the Caribbean, and give a scholarship to young people from the most remote areas. But first, it was in Central America, and after the project it was extended in many parts of Latin America, and now in many parts of Africa and Asia. Then now the school has been graduated since 2005, more than 10,000 doctors from at least 48 different countries, but now the school has students from 68 different countries. It's become an international school of medicine. 20 doctors every day, every year are graduating more than 1,000 doctors for many countries of the world were the vision to return back to their communities, to their countries, to contribute in the process of giving healthcare, better healthcare to the poorest of the poor. Then when we were students, we decided to organize, when we arrived to Cuba, and donate our vacation in the more remote area, to work in the most remote area. This beautiful dynamic helped us to engage with our community, to know better the reality of the community, but the other part is how the community can engage with his future doctor, and how can the future doctor can increase his commitment to return back to the community. One of the biggest problems what we have with the human resources, nobody wants to return back to the poverty. After you train, you want to look for better life, and then it is difficult sometimes to return back. Then we decided to do that exercise since 1999 until today. Our students every vacation are going back and work in the remote areas. Then after that, we were thinking about how we can develop alternative model of healthcare delivered in developing countries that is free for patient. Latin American School of Medicine will be graduating more than 1,000 young doctors every year from many countries. Then how we can design a model. Then we took this job in Honduras designing a model of healthcare, how we can reply in many others. Part of the country in Honduras, but in many other countries in Latin America, Africa, and Asia. Then we think about three main bases to develop that: human resources, infrastructure, and sustainability and continuity of this process. But I would like to share with you some pictures. That's the first meeting we had with the community in Honduras. As you see the video of our hospital, that was the first meeting with people talking about the idea, what we wanted to do, and looking for the people, what they think about project. Because sometimes we arrive into the community and tell the people we're going to do that before consulting with them and discussing with them, is that their priorities. Then there was one of the exercise that we made, asking the people and talking with them about their priorities. And some of them believe that can become reality, and others didn't believe, because people are victims of the politicians every 4 years telling lies, giving promise, and they don't return back after they get to the power. And people decided to make a piece of land, and we cleaned it with people and built the first facilities. That was our hospital in the first time. Then attending people there, talking with each patient, what was our goal, how everybody contribute to the construction work, and donating voluntary work. And from that strategy that people can donate voluntary work, we can develop another concept of social property. And people get engaged with the process, they feel honored of the project, and they can protect the project. And it was exercise very interesting in this beautiful process. Then everybody, we were looking for some donation to buy the construction material, rebar, cement, and everybody was engaged and involved in the process. As you see in the picture, children's and women's, men's, everybody in the construction of a new hub. No, we always say that no one person can do more than what we can do together, which was some great project that we can develop with our hand that make people defend it with their life. No? When we get to this level in Honduras, we get to this level and that we reached in 2008. Since 2005 we start. Sometimes we build for 2 months and start looking for resources for another 6 months and build another 2 months. That was state by state, with this brilliant idea to walk to the utopia, how we can reach to our dreams. Then we got the observation room. As you see, many of our materials come from Solidarity. Those beds, I get bed in Pittsburgh, Pennsylvania, but if you see some of those beds in California, then that's a postpartum room. Some newborn inside the hospital. This work has been helping a lot in the process of infant and maternal mortality in the area, who has been very substantial, positive work to solve this problem When we arrived to the area, the infant mortality was very high. In the country, it's like a 32.8. Now in the area where we were working last year, it was 0, because of the efforts. It's a demonstration how much we can do with nothing, without the government support. Then we have the external consulting, UAN, ultrasound department, which is very important for us in diagnosis. That's the first time in history people got access to it. And as a diagnosis, but as a therapy, it's the first time pregnant women that have access to free ultrasound. Then can people, sometimes they travel 18 hours, 24 hours to get to the hospital for an ultrasound with diagnosis. It's difficult to change that process, because I always share with my companion that we reach to the hospital in the morning and people have three lines. This for ultrasound, they say, this one for lab, this another one to see the doctor. But you learn at the med school that doctor have to send you to the ultrasound diagnosis. But how can you deny ultrasound for a woman who has been traveling 24 hours, 18 hours, say 6 hours or 8 hours to get to the village? It's difficult to do it. Then we had to operate on this process. Then we have this lab, dentistry room. Before the coup happened in Honduras, we developed a system how we can create more access to the healthcare at the university, at the hospital. Then we opened 11 small clinics in the community with our doctors working in the day, attending people, giving workshops, and the school, visiting home and at the home card. That gives us the process to develop a system to put a doctor attending like 2,000 people, knowing the problem of each people, making a file for each family, not only to look for the problem of healthcare. It's a new vision of integral healthcare. This process helps us to identify the background and the family of healthcare and develop a system of preventive healthcare. But then another to identify if we have disability even at home, if we have children who didn't go to school, what is the problem inside? That gives us more argument in the process of demanding more attention to the area where we were working. Then we built this small school to train single mothers in the community as a nurse. We become a great strategy to train new human resources who can be permanent in the community. Then now we are building a project how the 6 nurses who have been graduating, how we can look for people, institutions who can give the solidarity to sponsor a nurse for a year. Then this is our dream in the future, we have the right to dream too. We have the right to dream and build the surgery room, and build the pediatric area, and build the physiotherapy area, rehabilitation, and build an area for alternative medicine and Garifuna medicine. We have a sea in front of the hospital, an ocean in front of the hospital. An alternative area will be great because we can use thalassotherapy, which is the therapy with ocean, then sun therapy, fungotherapy, and many other alternative medicine that we are involved in this process, and use the Garifuna medicine, who is very rich in concept of science. Many years, the National Autonomous University was founded in 1847, and it was after 118 years the first Garifuna become a doctor. That means our people survived for more than 118 years without doctors. Then that gives us the value of the knowledge what they have about medicine. And we believe in this process and how we can link all those ancestral knowledge with those knowledge that we get from the university and make better living for the people. Then this is our dream for the front part, and this is our dream for the back. We can dream from every side. And that our exercise in this process, and because young people have to dream in this process, and we can achieve those dreams. The difference is we like to dream when we wake up, when we wake with our eyes open, then we dream and we can walk to achieve the dreams. Then we continue the process organizing the community, working on preventive healthcare, and this gives empowering to people because we're building people power. Discussing with the people the problem of healthcare, but discussing with the people the problem of the country, discussing of the people what their need, what the problem of the village, what their needs. Then the people can have more argument in this process. They can get more information. That's why some projects like this become a little bit dangerous to the system, to discuss the real problem of the rural community, to discuss the real problem in the country, to discuss the problem of the economy, to discuss even the politics, how the country is living, who become a great exercise for people to do discussion in the communities again among that. Then we have a group of midwives who have a great work. Then we learn from the midwife and we share information with them. Yeah, you can see the tradition of the midwife in our country used to be the grandma trained another woman, a young woman, to be the midwife because maybe it's the only woman who didn't have the opportunity to leave the community. He's the last one, he's the first one who didn't have the opportunity to leave the community. They trained him as a midwife like a way to survive, to learn how to deliver baby in the community. Then we have this link to work directly with the midwife and work together to decrease the process of maternal mortality and infant mortality. That has been a wonderful job, a beautiful job to start this wonderful relationship with the midwife, who is new in the process because the usually traditional doctor who arrived to the area used to say that midwife is the one responsible for the infant and maternal mortality. This is because of the system, which as a strategy has been and mediocre, I don't know how to say it in English, but has been they didn't have the capacity to solve the real problem of many of the area, then the infant mortality. And the strategy that they have with the money of the Ministry of Health is not used in the right way to solve the real problem of the people. And as you see, nobody even controlled the woman who are during the pregnancy in the area. Then this is one of the causes of the process of maternal or infant mortality. Even the woman didn't know if she has hypertension during the pregnancy, if she has diabetes during the pregnancy. That's increased the process of because she don't have access to it. People don't have money to go and monitorize and do the normal or the routine of seeing the doctor, because when you go to the doctor, you have to pay $50 to see the doctor, another 50 for the medicine. If you make another diagnosis, another 50. How people who are fighting to eat with 10 cents every day, they can find out the money to visit the doctors. Then we're working now in the process of new alternatives to develop in the community as alternative to look for better life for the people. Then we found many of the problems like a sacrolombalgia, who is a back pain, is inflammation of the muscles of the spine. Because the people carry wood every day, 100 pounds to cook the food for these children. Then this is a good example for us how we can do exercise of this integral view of medicine and the biopsychosocial way, because a human being is not only anatomy, how we learn at the university. That new view of human being who think, who is living in the environment, give us the strategy to do a biopsychosocial diagnosis and how we can do a biopsychosocial treatment in that way. And that becomes very interesting, this process, because if we see this pathology of inflammation of the muscles of the spine, what we call sacrolombalgia, you go to the book and they teach you that there has to be solved with anti-inflammatory. The less expensive that we have in our area is ibuprofen, 500 or 600 milligrams too. One pill every 8 hours for 3 times a day for 7 days. And they send you home to rest for 15 days with your leg up like this. But our question it was, how can a woman with 6 children can go and rest for 15 days? It's not, with the reality, it's not really. Then we decided to look for the causes of this problem. The real causes is the poverty, but the immediately causes is the people that carry wood every day. Then we developed this system of solar cooker, who we founded and well researched, specifically from an organization in California. We select the more cheaper one that they can make it inside the community. Then just we simply carve wood and aluminum foil. Then we work in this process to make it in the community and in our office in La Ceiba. Then with this solar cooker, people can put the rice, a little bit of oil, a little bit salt and water, put it in a black pot and turn it back and put it in a solar cooker and go to the field. And when they return at 11, the rice is cooked. And they don't have to be worried to bring more wood. Then we can make a strategy to save the environment, by saving more trees. But the other thing is we can save the children for many other respiratory disease because of the smoke. But the other side, we're facing many problems with the parasite and worm medicine and worm. And we're facing problems with anemia because of the parasite. And most of the problem with the parasite because of the quality of water. Then you can have access to boil the water in the solar cooker. But the other things you can have access to fight against this disease we're provoking because the problem of quality of water. Then with this exercise, looking for this integral solution to one problem, we can solve many others. This become exercise for us to do this work. Then even though we have a group of doctors who work voluntarily in our hospital providing free health care, until now we have been providing more than 500,000. We have been seeing more than 500,000 patients for free. And after the earthquake in Haiti, we had the opportunity to send a team of our doctors to work in Haiti. After the earthquake, I reached to Haiti the second day after the earthquake, and after that we returned to build a team from a big team of the doctors who were training in Latin American School of Medicine, and we have a great experience in Haiti. We invite many doctors to come, then arrived 728 doctors from 26 different countries, which is something marvelous. You don't hear about that in the news, but it's something real who happened in Haiti. We still have part of our doctors, more than 220. Some few of them, like 175, decide to do their residency in Haiti for 2 years, the residency in family medicine. Another team decide to accompany them. Then we still have then I had the opportunity to be the coordinator of that international brigade in Haiti. It was a wonderful work to share. Even we don't have too much doctor, how we can share with others in this process. Then as you know, and if you recognize that picture, it was very common in the process of the coup in Honduras, and was the reality in 2009, was still the reality today. We still the reality, even though government have been changed with the election under the coup d'etat, continuing the violation of the human rights, continuing the process of assassination, but it's increasing to the movement of national resistance, who was against coup. Now is the national resistance movement to rebuild the country, which is a very wonderful movement. But we continue seeing the process of many other people involved in this idea to rebuild the new country, but many assassinations every day, people dying because of the many journalists have been dying, many campesinos, many leaders who were selected to the assassination, many lawyers who work in those processes. Recently, the same strategy who the government has been applying in years before in Maduro's government to burn people in
jail.
In the
Yeah.
jail? Okay.
Prison.
In the prison. And we had experienced some years ago that they have the same action in the prison in La Ceiba, who they kill like 79 young people, and they burned them in a small room, 79 young people. They tried to select and put 2 people from different bands to fight against each other. And after there was 2 accidents in this fight, and they recognized that this was a strategy from the military who were in the jail, and they stopped the fight. And they burned all of them in one afternoon. This was something. And some month after that, they burned another 148 in San Pedro Sula. As this has been a practice of the government in this process. Then some week ago, they burned 438 people in the prison of Comayagua. And government come the next day to say, no, I'm so sorry because it was an accident, something a little bit that we have to learn how to fight against it, and how we can raise our voices and how we can share the information to people like you to help us to spread the word. Because now media is not talking about that reality anymore, just the first days. After even some important international observator who came to give solidarity to the government position in the process that it was a real accident of a cigarette, a simple cigarette, with more than 400 people who couldn't fight against a cigarette. Then born a small bed, and this bed born all those 438 people. And the key, it was, lost in that time that they were burning the people, And after that, they have been returning like a 40 of the body to their families. All the bodies are out there in this composition. And they return some of the body to their families. And one of the important things is they're returning the body in this composition, but you cannot open in the box. They give it to you just to put it in, take it to the cemetery. But many of the people have been opening the box, and they can see the bodies and shoot in the bodies and see what was the problem of the how the people died. That it was because the fire, many of them was shooting in their head, in their face, and many part of the body. And this and nobody's talking about that anymore. And if you see the problem now, many of people are outside in a capital waiting for the family's body, what is happening. And that's why building the solidarity, building this network for us is very important. Even though it's dangerous when we return the country after expressing this truth. But for us, it's important to do that. As a young people, we believe that with the time now to say no more for what is happening in our country and stand up to fight for it and build a new country for our people. I would like, because the time to stop here and to give the word to you, and it's a great honor for me to be here sharing with you. Thank you.
We're gonna open to the questions. People have questions. Can submit it again. To Luther.
How does your you and your medical community in large, including Latin American School of Medicine, how do you all connect with, or approve or disapprove of Doctors Without Borders?
We didn't have the opportunity to work together with Doctors Without Borders, and we didn't have. We work in Haiti, but they were from their side. The Haiti, it was after the earthquake. Everybody who came there to do some job had permission to do it. We always have some rule in the work that we have to do. We are doing. We work hard in the process of preventive health care. Our many focus in Haiti was to save life. The other thing is what to prevent, like epidemics like cholera, and it was thanks to that work of many people who saved in the process, because since the time we arrived there, our work was working hard night and day, working hard there, and began working with the people and working in this process of prevention of healthcare. We just, I didn't have this experience to work with Doctors Without Borders. I didn't have contact with them already. One of the things that we have is that today, Latin American School of Medicine have 10,000 doctors who have been graduating. It's the more largest army of doctors in the world. And we don't have the money to apply a program like Doctors Without Borders, like Medicas Mundi, and many other doctors who has the money to do it, but they didn't have the human resources. We have now the more largest human resources in the world to apply any program in any part of the world. We are open to join, by any other institution who have the economic resources, and how we can develop a program in many other parts of the world together. Now we have the logistic, we have an organization where we're gonna have the meeting, international meeting at 17th of July in La Habana with more than 5,000 delegates from 48 different countries. We come together to build this organization that we call Medisur, who's gonna be Médicos del Sur. It's a great, huge organization of doctors from Asia, Europe, Asia, Africa, Latin America, and North America too. We have in Latin American School of Medicine more than 150 students from US. And more than 30 of them have been graduated. They even have a web page. I was communicating yesterday with them because we're working in the regional meeting. They're gonna travel to Honduras for the meeting, and some of them will travel to Haiti for the meeting from US. We have the regional meeting, Central American meeting, South America, Caribbean, before the meeting in July in La Habana. That's gonna be a great opportunity for us to see the rules, how the organization will be developing, and what gonna be the strategy that we're gonna build with any other international organization who are doing work in healthcare around the world.
Can you give me a little information on what you came across when you first were able to get into Haiti? Some of the reports that I heard were that the relief efforts were really hampered by the fact that the military had taken over the airport and made it impossible for relief to get in there. And then we also heard reports that the military, including our military, the US military, were responsible for contaminating some of the water sources that the people were using. If you could shed any light on that, I'd appreciate that.
Oh, let me share a view with you, a small video, 8 minutes. If you wanna. And we have time?
Visibles están las huellas de la destrucción en Haití a 2 meses del terremoto. Algunas no se ven, pero quedarán para siempre. Sin embargo, una mano tendida puede aliviar el dolor, puede iluminar la noche más oscura. Una mano que se tiende puede ayudar a recomenzar.
Yo dejé trabajo, yo tenía 2 trabajos, trabajaba en 2 lugares, dejé a la familia, ya la vida por allá, dejé todo y me vine siguiendo mi corazón.
Nosotros somos lo que tenemos que llevar esa idea, de que el médico está para la gente y vive por la gente, no importa si tiene dinero o no tiene.
No deseamos otro pago que no sea la gracia de nuestro paciente y el tener la satisfacción de que salvamos una vida, de que hubo un niño que llegó enfermo y salió bien, de que vino una madre que nosotros pudimos atenderle su parto y trajimos una nueva vida a este mundo. De hecho, yo he ayudado en 2 partos y ya hay una niña que lleva mi nombre.
Son médicos graduados en la Escuela Latinoamericana de Medicina de Cuba. Ellos la llaman por sus siglas, ELAM. Viajaron a Haití impulsados por sus principios humanistas. Se unieron a la Brigada Médica Internacional Henry Reed para dar salud y amor al pueblo haitiano.
Porque no hay mejor idea que formar médicos. Todos los profesionales son útiles en su rama, pero un médico siempre se va a necesitar porque siempre va a haber gente enferma, siempre va a haber niños con necesidades, ancianos, y qué más saber que cada uno de nosotros podemos contar con médicos para el mundo.
La lluvia hace más difícil la vida en Olympia Park, uno de los tantos campamentos de desplazados por el terremoto. El agua acumulada frente a la carpa, que habitualmente se usa como puesto médico, obligó a la comunidad a habilitar otro espacio de consulta para las jóvenes doctoras graduadas en la ELAM.
Ellos ríen poco, pero nosotros muchas veces sentimos, cuando pasamos, ellos nos estrechan, o sea, la mano o nos demuestran una pequeña sonrisa que para nosotros es lo suficiente.
La tarea de esta doctora peruana es recorrer los campamentos junto a un epidemiólogo y a un especialista en control de vectores para evaluar la situación sanitaria.
Y más ahora con la temporada de las lluvias, las condiciones de la vivienda no son buenas, se han mojado cantidad, tampoco tienen una disposición adecuada de la basura por falta de conocimiento en la cultura sanitaria. La cuestión no es que nosotros hagamos el trabajo, sino es trabajar con ellos, enseñarles tratar de cambiar su pensamiento en cuanto a cultura sanitaria, que es lo que falta, cantidad.
Siempre tiene pacientes el puesto médico y la jornada de trabajo para las jóvenes es muy intensa.
¿Y tenían antes médicos? ¿Tenían médicos?
No,
El desplazamiento desorganizado de la población después del terremoto obligó a fundar Cuba, hospital de campaña cubano-haitiano. Tienen prioridad los niños, pero las necesidades de salud son muchas. Moody llevó a su madre al hospital, sufrió un accidente cerebrovascular.
O sea, esos médicos son los que nos aceptan nosotros. Son médicos humanistas o médicos humanitarios que pueden atender a los pobres.
Esta señora sufre de dolor en su espalda y el doctor Yudelin le explica que debe dormir sobre algo rígido para aliviar el dolor. Él trabaja en un hospital en la ciudad, pero se unió a la brigada Henry Reef y ahora sirve como médico en un hospital de campaña.
El ser humano necesita salud, el ser humano necesita la vida. Ellos se crearon para vivir, entonces nosotros médicos tenemos que ayudar a ellos para que puedan vivir.
En Cuba, por doquier aparecen las carpas. Son muchos los campamentos de desplazados. Los médicos graduados en la ELAM, acompañados por estudiantes haitianos de 5º y 6º año, asisten a los afectados por el terremoto, a los enfermos.
Y ellos, poco a poco, de acuerdo a lo que fueron identificando, a la semana cuando visitamos esos asentamientos, realmente la realidad era otra. Yo me quedé asombrado en ver que ya habían organizado calles dentro de lugares que no se pensaba que podía tener una calle. Les explicaron la importancia de tener letrinas sanitarias. O sea, un grupo de acciones que realmente, no me cabe duda que al final han logrado que no se desate ninguna epidemia conocida en estos lugares.
Sonet es uno de esos lugares donde se congrega la pobreza. Las niñas de Sonet ríen porque el doctor libanés es torpe al ponerle las medias a la pequeña Angela. Samuel estudia medicina en la ELAM, está en 5º año. Pero su país lo necesitaba y se sumó a la brigada Henry Reef.
Aquí se dice que no digan que los niños juegan con la basura, no digan que los niños buscan comida en la basura, que eso le puede traer muchas enfermedades. Aquí también no digan que los niños orinan en los ríos, ni tampoco defecan en los ríos.
Su trabajo en el campamento es realizar acciones para prevenir enfermedades.
Avant médecin cubain était venu, là t'es plein fatigué, tu me dis qu'on a pipi n'importe côté, là où t'es venu, t'es ouais ça fait nous mettre menu, yo propre t'es au fond côté pour nous jeter fatigué, au fond côté pour nous pipi.
A pesar del hacinamiento, pero en un lugar limpio y ordenado, las niñas de Sonet entretienen a Angela, que encontró acomodo en los brazos del doctor libanés. A 2 meses del terremoto, a pesar de las amenazas de las réplicas, del descanso en carpas, de la falta de agua y de energía eléctrica, los graduados de la Escuela Latinoamericana de Medicina y los estudiantes haitianos se comportan a la altura de los experimentados integrantes de la brigada Henry Reef. Trabajo duro por el día que alterna con las incomodidades de la vida en campaña.
nosotros tenemos que levantarnos sabiendo que hay un niño esperando por nosotros, sabiendo que hay un niño que necesita la atención médica. Entonces esa realidad, ¿me entiendes? Y la idea con que nosotros fuimos formados de ser médicos humanistas, de tener la sensibilidad de sentir el dolor ajeno, esa, ¿me entiendes? Es lo que nos motiva todos los días a levantarnos para ir a trabajar.
Recuerdo la canción que decía un día, que en el fondo no sabía que eso era malo para mí.
A veces me parece increíble, porque aquí estamos de muchos países, de muchas nacionalidades, de muchas realidades, de muchas vivencias individuales que se conjugan en un solo objetivo, es el dar esperanza de vida a este pueblo.
Una víctima total de sus antojos, pero un día abrí los ojos y contarle a la piel de mi memoria.
Todos los que estuvieron en el ELAM, todos vieron con un propósito, ¿no? De formarse como médicos para salvar vidas. Esa es la gran meta y que hace que no haya distinción de razas, ni de países, ni de religión, que todo el mundo se une a una noble causa, ¿no? Eso. Formarse como médicos para salvar vidas.
En Carrefour, el lugar más cercano al epicentro del terremoto, pobres casitas se extienden por el separador de la calle. Es un domingo de marzo y en este hospital de campaña, junto a los especialistas cubanos, hay médicos de la ELAN de 11 nacionalidades.
Y no sé, sentí que tenía que venir y ya lo iba a dejar todo por venir, igual.
Mi padre es obrero, mi madre ama de casa. Yo jamás iba a tener la posibilidad en Chile, sin embargo hoy, yo con lo que me dio Cuba, puedo darle estudios a mis hermanos. Entonces es algo importantísimo, se abren los caminos porque ya no soy yo, son mis hermanos que van a generar también cambios importantes y en mi país y donde se necesite.
Algunos están de guardia porque tienen pacientes como esta mujer de 8 días de parida que llegó al hospital con fiebre.
Que si tú sabes de que él está sufriendo es por algo, porque le duele y eso, sentirlo y no dejarlo ahí nomás de que ya con eso se valida, no, sino que ponerte en su lugar, ponerte en el lugar de los demás. Ponerte en el lugar de los demás cuando en el momento que están sufriendo o están padeciendo algo. Y ayudar. Siempre ayudar.
También está Miñón Emil, que al caerle encima el techo de la casa, sufrió una fractura de pelvis.
Ahora se va mejorando poco a poco, porque anteriormente tenía una hemiplegia de la parte izquierda, no podía mover el pie izquierdo, y también la mano izquierda también tenía este mismo problema. Ahora se está haciendo más esfuerzo.
Un chileno graduado de la Escuela Internacional de Deportes y Educación Física de Cuba rehabilita a Miñón. Él también es parte de la brigada Henry Riego.
Aquí lloramos juntos, trabajamos juntos, pero ella sabe que puede salir adelante y su problema lo va a sacar adelante. Así que estamos dando todo el empeño posible y el máximo por cada paciente que llega aquí.
Vraiment pas un petit peu d'analyse parce que on parce qu'on a un paquet de temps, si on pas qu'on a un paquet de temps pour marcher, même pas dans quelques semaines encore, on va commencer à faire pour marcher.
Puerto Príncipe se empeña en recuperar su ritmo habitual. Mercadeo en las calles, tránsito, pero alcanzar la normalidad aún no es posible. La gente desmantela las ruinas buscando lo que puede ser útil para vivir. Aún hay edificios tal como los dejó el terremoto. Así en lo que fuera un hotel, están todavía los cuerpos de quienes fueron sorprendidos sirviendo una mesa o quizás haciendo el amor. Muy cerca del aeropuerto y como una paradoja, está este asentamiento que creció a la sombra de la propaganda que invita a comprar equipos electrodomésticos y nuevas tecnologías. En el campamento de Belé se aglomeran más de 1000 personas.
Está normal, c'est moi qui a venu de nous, même si on a habitué à faire là. Et au même tout de suite.
Este joven ayuda en la consulta, organizando a los pacientes.
Trabajamos mucho todos los días.
Muchos pacientes.
Sí, muchos pacientes. Y a Dios así.
Un estudiante haitiano de 5º año de medicina ayuda en la traducción al doctor Castillo, un graduado de la ELAM, director de un hospital en una región muy pobre de Honduras.
Ahora nosotros tenemos un trabajo muy importante con los estudiantes haitianos y los médicos haitianos, porque sin duda ellos son los que van a quedarse aquí para llevar a cabo este proceso, y los acompañamos en esto, y hemos tenido con ellos un buen rapport, pero también nos ayudan mucho en el idioma y conocer también la cultura de este pueblo, que es para nosotros muy importante. Creo que este ensayo de trabajo para nosotros es muy bueno hoy.
Camino a Cafufey se aprecian las huellas de la tragedia, las de las viviendas y la más dura, la tragedia de los niños marcados en el cuerpo y en la mente. Dicen que Sonsón narra de un tirón a cada visitante el drama que vivió el día del terremoto.
Eso es el terremoto, vámonos, corre. Y la gente se corre, y ahí tenemos una puerta que no se puede abrir, y está peleando para que se abra la puerta, y toda la gente me dice, ayúdame.
Habla muy bajito Sebastián. Cada día en el puesto médico lo curan.
¿Qué dice?
Está mal, que no le duele, porque es lo que yo siempre le pregunto.
Y en brazos de un estudiante de la ELAM vuelve a su casa. Pasará mucho tiempo para que olviden. Muchos no olvidarán nunca. Quizás sea...
We're going to stop it for the next round of questions. We have like 15 minutes. We would like to see the whole video. Unfortunately, we have to leave at 8:30. And then, please be brief in the question. Any other question?
How big is your, how many beds does your hospital currently have?
It's a small hospital, it's 15 beds.
15, and the goal is what? How many do you want to have? What's your vision?
The goal is just we build the area to have like 50 beds. This is what our goal in the future. So we dream to have us. We're fighting to build a surgery room that we can solve many of the other problems in that area. Then we hope that for August we're gonna have accomplished that goal.
We're just gonna pass the bucket for people who willing to give some donation for cost of the trip, the cost of the trip of Salud Castillo, and then whatever you want to help with it, you're welcome. Question? Anyone more have a question?
I have a chat.
Yeah, make checks either to Luther Castillo or to Peace Action Wisconsin, which is acting as a fiscal agent for him while he's in the United States.
Luther, I remember you saying in an earlier presentation, because somehow I've been following you around here and there. You said something about when you flew in, you had to come in from, you couldn't land in Haiti, you had to...
Yeah, we had to land in Dominican Republic just on the second day. We couldn't land in Haiti because the airport was taken by the U.S. troop. It was difficult to land. Then we had to land to Haiti. We do have to land in Dominican Republic. That was something that was difficult. That's why it was difficult for us to bring early doctors directly from their country to Haiti. They took them from Haiti to Cuba, and Cuba has regular flight to Haiti every Saturday, then and Wednesday. Then we had to bring the doctors to Cuba and fly and go in the regular flight every day. And it was something shocking to see many soldiers with guns in the street of Haiti and the street of a destroyed country, where people need food, water, medicine, and then we believe that maybe 10% of the money that they spend, and now those military people in Haiti, we can solve many of the problems that Haitian people are facing now in the area. It's very shocking to see that, but it was a reality that we lived in Haiti for 5 months, in this process of who is a little bit difficult to lead, but Haitian people are very strong, and we believe that for us who know the reality and history of Latin America, Haiti was the first country in Latin America to get their independence because of the brilliant idea of Toussaint Louverture to fight against the slavery. But in the middle of the battle against the slavery, when he decided to fight for independence, it was so brilliant idea in those years. But colonialists never forgot Haiti because of that action in that years, who showed many of countries of Latin America the path to fight for the freedom, that it was possible, the independence. You know, that's one of the reality of Haiti. That's what I feel personally, and all of my companions feel that way with Haitian people, because they show us that the independence was possible.
Any other question?
So how much, what role does alternate medicine play? Is it equal or?
What
alternate medicine.
Alternative medicine.
Yeah.
For us, it's very important. More in the underserved area, we don't have access to much for pharmacological medicine, and work in the process to develop a system of alternative medicine in the area, but work very deeply in the preventive healthcare, who become even less cheaper, much cheaper than fighting against the disease when it's already in place. Then we believe in alternative medicine. We believe in the natural medicine. Garifuna people are very tight to the roots of natural medicine, because we have been living in a natural environment, eating natural foods, and we believe in the process of natural medicine. The problem that the system have been fight against the natural medicine. You know, persecution for the people who practice natural medicine. And now we come with this idea that we're gonna work together with our people who practice natural medicine. And this become a new engagement, and they can feel free to practice the natural medicine. And we can contribute with many other studies that scientifically approve of natural medicine in this process, and we can join that knowledge together. For us, it's the same importance, that knowledge that we learn at the university, you know, but the strategy how we can put it together and join those knowledge together, and we can work together with the people who practice alternative medicine.
Any other question?
Can I ask one more? Do a lot of women take up medicine? They go to train in the Latin America School of Medicine, or are there any barriers, social, cultural barriers for women to take up medicine?
Always when we get a scholarship, we got 50% of women, 50% of men. Now we have more women than men, and traditionally there's a process of education. And most of our forces and the war are women in the process of, in our scholarship. We have 87 students as a Garifuna, but we have 500 as a Honduran in the process of education. And then now, more than 500, we have 800 as a Honduran training at Latin American School of Medicine. This year, it was 280 Honduras who become graduated this year. And from that, 23 Garifuna become a doctor, you know. I was reminding that the National Autonomous University was founded in 1847, and they graduate one Garifuna every 20 years. If you see the number per capita of how many Garifuna doctors we have with the assistance of National Autonomous University of Honduras. This year, Latin American School of Medicine, we graduate 23. That we had to wait centuries to that happen in our country. That's why this project represents a lot and deeply for our people. And the Garifuna culture is very matriarchal. A woman has a lot of power in the community. We do what women say, and even we, our people in the village have to say, men has the last word. Yes, my love.
Could you talk a little bit about the threats you have on your life, and how you're dealing with them, and you know how maybe hopefully they've gone away?
For the peace of the mind, I always like to think that I'm safe. But the reality is different. Even though we have some theoretical protection under the umbrella of international human rights organizations from Washington, that people have to design their own protection inside the country. Even living in the country with violation of human rights, with assassination. But we have a decision in life, and many of us have to do this work, what we are doing now. Many of those have to travel and spread the word. Many of those have to be and many other media is doing the same work. Many of those have to be in the street. And many of our brothers have been died, fighting for this. And that's why we have this big commitment for this struggle. And we believe that many of the action of the solidarity have been helping us to protect our life back home. Many of brothers and sisters who are being accompanied in the process, traveling to Honduras, talking to people here, writing to their representative, making them sign the letters, and giving action against those companies who make business with those people who from the oligarchy who violate the human rights and kill many people in Honduras. This is an effective action that we can make. If you don't touch the economic interests of the oligarchy, they don't care about it. They care about their economic interests. If we make, a strategic action sometimes that they can affect the economic interests, that's the only way that we can have a little bit impact in this struggle. Then this is part of the struggle, and we believe this is part of our mission today. And because if we don't do nothing, we're gonna be guilty in front of the next generation that we didn't do nothing to change. Not all of us can leave the country. Many of our brothers who leave the country, to send money back home. Sometimes governments say, wow, the money what we receive from the United States, from our brothers there is the one to support the economy. But when they return back, deported, they treat them like animals at the airport. Many of those things have to change. We believe in rebuilding a new country for our people. That's why we are doing this dangerous but wonderful work.
Yes, didn't they declare you public enemy number one and you were in hiding for several weeks before you went in exile?
It's just difficult to say exile for me. I never left the country for a long time. I usually get in, and the more difficult time it was getting, and when it was a little bit hard, get out to Nicaragua, Salvador, and spend a week and get in, because it's difficult to leave the struggle. It's difficult for us to be outside watching the television. You feel more pain when you watch the television without staying there. You have to be involved with various sometimes in the struggle. But this space of Haiti helped us in the process. Then I left Haiti to return back to continue our struggle in Honduras and prior then. I travel to Haiti every 2 months, to supervise, do work with our team who are there. I was there a month ago, approximately. I will be there in maybe in the first week of May, and continuing this marvelous work. Then I think I was never the first public enemy. The public enemy of the oligarchy is their consciousness. They follow them everywhere, because how many people they have been killing because of hurricane of poverty, and we think that the all consciousness is the public enemy of this part. Thank you for your time. It has been a very important for me, and I'm very grateful about you spending the time to listen to us, and we'll be very grateful if you help us to spread the word. And you can continue giving support to our project. I can leave some of my cards here. If anybody wants to collaborate with the hospital, they can send letter. We can tell them what can be the way how they can help. Even and the small donation, like send a small bottle of ibuprofen, Tylenol, you can be saving some lives. Sometimes you think it's very insignificant, but if they reach home, save life of many other people. Then every little things that we do is so important to this struggle. Then we can communicate and have some access to information. Thank you, brothers and sisters.
Thank you very much to everybody. No more questions, I think we're done, but we have some refreshment here, like empanadas made by Fred.
Thank you, Brother Fred.
We're ready to go. You not told me that you was part.